and this might be a surprise to listeners, but can you explain how the same company that makes M&Ms owns thousands of vet hospitals?
Mars.
Yes. Explain this. Welcome back to another episode of the podcast for doctors by doctors. I'm Dr. Michael Jerkins, flying solo again today. Apologies if you got really used to Dr. Palmer in the last episode. He is not with me today, but with me in spirit. And today we are really diving into something that a lot of people have experienced in the doctor community, especially over the last 5 to 10 years, someone who's practiced in corporate medicine and been in that kind of rat race or practice setting, if you will, probably a more positive way to describe it, and decided to hang his own shingle. We've had a couple of people like this already on the podcast, but this one's slightly different. And I'm very interested in their journey and walking us through how they navigated that, why they did it, what was their experience like training and getting into a more corporate setting or employed setting, practicing, and also a veterinarian, because I don't think we've had a veterinarian yet on the show as a guest. We will try to fix that, but we are very excited for this particular person who has a really unique story and is going to shed some insight as to the thought process and how it actually worked to exit corporate practice for independent practice and having the freedom to practice in the way that they want. So enough hot air from me, and let's get to our interview. Today on the podcast for doctors by doctors, we're joined by Dr. Adam Moeser, the founder and owner of Wisconsin Veterinary Neurology and Surgical Center in Mequon, Wisconsin. Dr. Moeser specializes in the treatment of dogs and cats with neurologic disorders. And prior to opening Wisconsin Veterinary Neurology and Surgical Center, he was a staff neurologist and medical director at MedVet in Commerce, Michigan. Dr. Moeser graduated from Knox College and then attended the University of Wisconsin School of Veterinary Medicine. Following graduation from veterinary school, he completed a 1-year small animal internship in the Chicago metropolitan area. And then Dr. Moeser completed his veterinary neurology residency at the University of Pennsylvania. In addition to being a hospital owner, Dr. Moeser is also a minority owner in the Green Bay Packers. No big deal. When he isn't working, Dr. Moeser enjoys spending time with his amazing and supportive family. He enjoys gardening, weightlifting, and spending time with friends. Dr. Moeser, welcome to the podcast.
Thank you for having me. It's a pleasure to be here.
This is awesome. And I will say this is groundbreaking because you are the first veterinarian to be on the podcast.
It's an honor.
When did you decide you wanted to be a veterinary neurologist?
A lot of people have had the dream since they were a little kid. That wasn't necessarily the case with me. I've always, grew up having animals in the house. They were always an important part of my life. But going into undergrad, I tried several different majors out. At first I wanted to go into finance. I thought about going into, physics, astronomy. And I was trying stuff out, especially during my first year of undergrad, and biology just seemed to click the most with me. During first year, trying different classes, and so I decided that I wanted to pursue something in the field of biology, and just with my love of animals, it seemed like a natural fit for me. And so I probably made the decision late second year of college. Definitely by third year, I knew that's what I'd wanted to pursue. And that, I always tell people going to undergrad, try not to have a closed mind on, this is what I'm going to be. Like, try things out, try different classes, English, biology, languages, because you never know what you're going to fall in love with. But it was during college.
Walk us through then getting into veterinary school. When do you normally decide when you want to specialize? And obviously you got more training. So walk us through that decision and how you picked neurology.
Veterinary school is a little different than medical school. You can, so veterinary school is a 4-year program. And when you're done with veterinary school and you've passed your national boards, your state boards, you can go out and practice veterinary medicine. If you do go out into the field to practice right after veterinary school, you're probably doing general practice or ER medicine, or it's, and when I say general practice, that could be small animal, it could be large animal. If you are interested in specializing or you think you just want a little extra training, and for me, I didn't even know that I necessarily wanted to specialize right out of veterinary school. I didn't feel 100% comfortable going out practicing medicine yet after my fourth year. And I wanted another year of mentorship. So I decided to do what's called a rotating internship. So with a small animal rotating internship, you spend about 50% of it's a 1-year program. You spend about 50% of your year doing emergency medicine, and then the other 50% is typically spent rotating through different specialties. And that's when, during that internship, I had some experience working in a basic sciences neurology lab during veterinary school. So I knew neuro was a field that I enjoyed, but I didn't know that I wanted to become a neurologist. It was during my internship um, that that fascination and desire grew just from I had um, worked with one of my mentors, Dr. Heidi Barnes, who, interestingly enough, now I'm getting the chance to work with her again in Wisconsin.
That's awesome.
I had a really positive experience working with her, and decided that neuro was what I wanted to pursue. And then during my, latter, like the second half of my internship, when I knew I wanted to specialize, that's when you have to start getting your letters of recommendation together, your application, and you apply during that internship year.
Got it. So then you did your residency, and then walk us through your first year practice out. Like, what was that like?
Residency is a 3-year program, and very similar to, I was leaps and bounds more comfortable with my medicine and technical skills after my residency, but I still felt really green. And one of the reasons I went to Michigan, I grew up in Wisconsin, had never lived in Michigan, was for the opportunity to work with and be mentored by a very seasoned veterinary neurologist, Michael Wolf. He owned his own neurology only practice in Commerce, Michigan. So that's what drew me there, is I wanted to have that mentorship, and I'm really happy I did that. People tell you that your knowledge is kind of linear. You gain knowledge during your residency, but you learn exponentially kind of those first 2 or 3 years out in practice, because you just have to do it. You don't have a backup. You can't say, somebody else try this. Like, it's you got to do it. So I learned a great deal during those first couple of years, and it was really important for me to have that mentorship as well. And so a very positive experience for me. It's stressful and it's a lot of work, but it was very positive for me.
I can think back to my first couple of years in practice, and you're right, the buck stops with you. I mean, obviously there's colleagues you can call and mentors and things like that, but that's why I always challenge learners to try to make their own decisions in training. It's the safest place to fail.
Yeah.
So that you at least get that muscle, but it's hard to replicate what it's like those first couple of years out of training.
Absolutely.
How many years did you spend in the corporate side before you said, hey, I kind of want to do my own thing?
I went to Commerce, Michigan and Dr. Wolf owned the practice, very similar to what I'm doing right now. He was the sole owner, um, and it was Animal Neurology and MRI Center was the name of the company. And then I think it was that was 2013. I think it was 2017, if I remember correctly. He sold the practice to MedVet. MedVet is a corporation. They're not publicly traded, but they are, you know, they have shareholders. They started in, I believe, the Columbus, Ohio area, but now they are they have a presence nationally. And they bought the practice, and uh, we went from, we had neurology was probably 80-90% of our revenue, and we had a small rehab program, and we had a small ER program. The ER program was there just at nighttime. They weren't 24/7. One of the first things that changed, we went 24/7 on the ER side, and then we started adding other specialties, internal medicine, surgery, cardiology to the practice. So it became a true multi-specialty practice. And then I got the opportunity to act after Dr. Wolf retired, to act as the medical director and get my feet wet a little bit with the administrative side, the business side of things. And I had always wanted to come back home as well, and go to Wisconsin. And so it was hard. I really enjoyed my time in Michigan, and I learned a ton. And I think MedVet is a wonderful company, but getting back home was important to me, and it just opening my own practice felt right. And it's something business has been an interest of mine for a long time, and it seemed like a perfect mix for me.
That's awesome. And it sounds like it's been great so far. It's very stressful, obviously, opening up your own practice. What do you think the biggest misconception is that doctors have about starting their own practice?
For me, even having had the experience as a medical director, I completely underestimated the expenses as a practice owner. I remember when I was first working with Panacea and applying for my business, my startup loan. They have you fill out your budget, your projected revenues and projected expenses. And I look back at that process, and I really underestimated how expensive everything is. And I think, when you're working as an associate and you're not truly involved in all of the business decisions on a day-to-day basis, I think it's easy to think, oh man, they're just, these prices are ridiculous. They're just, all they care about is money, like these corporations, the practice owners. And then when you get into ownership and you really see all of the expenses that go into everything, whether that's the health insurance for your team, and retirement, and then just equipment, maintenance, purchases, I really underestimated that. And it's been a little bit of trial and error when it comes to my pricing. When I first opened, I was pricing myself kind of what I was used to pre-COVID in Michigan, and that was not adequate at all. And I've had to, increase prices, and I think we're finally getting to a more appropriate level. But that's been the biggest eye opener for me, is just, the daily expenses of running a business, especially a medical facility.
It's almost like parallels of what we were talking about earlier. Your first years out of school and in practice, you learn a lot just kind of by doing. Same thing with owning a practice. You really could have never learned all of what you learned as a practice owner until you actually did it, right?
Correct.
And you had tons of experience already, clinically and administratively. I did have questions on veterinary neurology, if I may, just that I'm fascinated with. So I, as a med peds doctor, human doctor, so common cases I see, I think if you listed the most common diagnoses would be like diabetes, hypertension, asthma, COPD, things like that, right? So those are kind of your bread and butter outside of preventative. What are those cases for a veterinary neurologist? What are the bread and butter diagnoses and chronic issues you treat?
The biggest things that we see are epilepsy, and epilepsy could be primary epilepsy. Just, we don't have all of the genetic mutations worked out yet, so we still use the term idiopathic epilepsy. Most of those probably are genetic. We just haven't figured it out yet. But then there's also, secondary epileptic cases where they've got a brain tumor or a stroke or encephalitis causing their seizures. So we do see a lot of seizure cases, and we're sometimes it's a family that just their primary vet has kind of gotten to the end of the road. They don't know what else to do medication wise. The seizures aren't controlled, and they just need us to provide a little bit more support working with that primary veterinarian. Sometimes the families want a more definitive diagnosis, and we're doing an MRI and a spinal tap to figure out what's the cause of the epilepsy. So that's a big one. Um, the other probably bread and butter for us is intervertebral disc disease. So because of breeding, and especially in dogs, it happens in cats, but not nearly as much in cats. But in dogs, we have developed all these breeds, and unintentionally we've bred into them some pretty significant degenerative disorders. So, for example, chondrodystrophic breeds like Frenchies and Dachshunds and Beagles, their discs age very rapidly. If we did an MRI of a Frenchie or a Dachshund at 2 years of age, we're probably going to see evidence of chondroid degeneration of that disc, and that degenerative process puts them at risk of herniating that disc. So we see a lot of disc herniation, especially in the chondrodystrophic breeds, and that might entail medical management using NSAIDs or steroids, pain meds, and rest, but it also can include surgery, and we've got to do advanced imaging to get a diagnosis. So at my practice, we use an MRI to make that diagnosis. You could, in some dogs, use a CT to make that diagnosis, and then following that up with surgery. So um, and then probably and I mentioned this earlier, another big item for us is the encephalitides, just the inflammatory diseases, especially in dogs. Again, um, a lot of the toy breed dogs, Maltese, Yorkies, they get autoimmune inflammatory diseases of the central nervous system, and that can include inflammation of the brain, so encephalitis, or inflammation of the spine, myelitis, or both together. And so diagnosis using MRI, spinal tap, and treatment. Um, and treatment oftentimes is a really long-term treatment. Steroids, chemotherapy drugs like cytarabine for its immunosuppressive effects, cyclosporine, but we have to manage those cases for sometimes years. And so it's with veterinary neurology, some of your cases are short-term cases, like the dachshund or the Frenchie with a herniated disc. Usually you talk to them and see them for maybe a month or two until they're doing well, and then they go back to their primary vet. Some of the epileptics and encephalitidy cases, we might be working with those families for years. So we see short-term clients, and we also see long-term clients. But I would say those, we see other stuff too, but those three things, that epileptics, inflammatory CNS diseases, and disc herniations, are probably the majority of what we do.
Fascinating. That is fascinating. Is there a breed of dog that has the highest incidence of epilepsy? Is there any kind of breed that is predisposed?
Any dog can get epilepsy. There are some dogs or breeds that have a higher incidence, and also some of, like, for example, the herding breeds, Australian cattle dog, shepherds. for whatever reason, they seem to be harder to manage. They oftentimes are refractory to typical medications. So there are some breeds, but any breed can be affected by idiopathic epilepsy.
This wasn't on my script, but I just had to, while I was talking to you, have a curbside consult of my own cat. This cat is old, but the cat is actually quite mean to almost every human being outside of our own family. And I used to live in Arizona. We flew the cat, which was a weird experience, by the way, from Arizona to Tennessee. And I was instructed by our vet. I don't think I was instructed. That's probably too harsh. I asked, I think, at the time for some sort of medicine to make sure my cat, made it through the plane. And so I gave her this medicine, and she was zonked. And then she was actually a pretty sweet cat. Then afterwards, everything's changed. She hates the world. I think did the medicine potentially mess her up, or is it maybe just more me as a terrible cat dad, giving her so much trauma with the flight? Is that a thing? Am I making this up?
I don't think you did any permanent damage. I'm guessing did they give you gabapentin?
I don't know. Actually, this was pre-med school, so I didn't know anything about any type of medical issues or medications or anything. Who knows?
I think sometimes cats just get a little bit more grouchy as they get older, just like people. So that might be what happened.
Actually, I had a patient who was she was a veterinary radiologist and specialized in large animal radiology. And I had so many questions because I just didn't know at the time. This was a couple of years out of residency. Basically, that veterinary medicine, and I don't think people realize this in the human world, that basically every human specialty that exists on the veterinary side. Is that generally true?
We're not as specialized. Like, an internal medicine specialist is going to do, not only work with, they're going to be your nephrologist and your urologist. We haven't necessarily gotten that specialized. Where like an internist is then going and doing a fellowship in just urology. But broader classifications like neurology, medicine, surgery. There's dentistry, there's nutritionists, there's behavioralists, ophthalmologists. There's, most of the specialties in human medicine can be found in veterinary medicine.
As a neurologist, are you mostly treating small animal, or are you treating large animal as well?
I just do small animal. When you do your residency, you do have to get exposure to large animal neurology. And your boards include large animal neurology as well. But that's one of those areas that I think it's just, unless you're working in the academic world where there's a large animal hospital nearby, it's hard to financially make it as just like a large animal neurologist. Just the economics of it. I mean, you probably in certain parts of the country could potentially, like I'm thinking Kentucky, make it as like an equine neurologist. But when it comes to like agriculture, there's still that economic decision that the farmers have to make, like how much money are we going to put into this animal? And so it's not as feasible to, outside of the academic world, it's not as feasible to do large animal neurology.
Makes sense. And there's several medical subspecialties that basically you can't do out of a large academic center because there's no way you can make money in private practice. So that makes sense. Explain to me how COVID changed how people behaved with their pets and the demand for veterinary services.
COVID was a really interesting time. So we actually, when COVID first hit and all the shutdowns were happening, we were so worried that the economy was just going to crater that we actually started cutting back our hours and doing part-time. Like, if we had normally 2 neurologists on staff, we went to just having 1 neurologist. The other neurologist was at home. And that we found that was incorrect, that assumption that the economy, at least the veterinary economy, was going to crater. And within a week or two, everybody had to go back to work. And it actually, the veterinary industry became leaps and bounds busier during COVID. And I think there's all sorts of theories as to why that happened. Um, During COVID, lots of people went out and got animals because everybody was stuck inside and they needed something to do, companionship. So there were, I think, a lot. The adoption rate went way up. Um, some people hypothesize that, you couldn't spend your money on vacations and stuff like that. And so people were spending their money on their pet family members. And so it actually got really, really busy during COVID. And we just, in the industry in general, we've, and we're still dealing with this. I think, the mental health aspect of veterinary medicine became much more, just a much bigger part of our daily lives. You know, Doctors, support staff, technicians. We've seen a big rise in mental health issues, in the workplace, and I think part of that is just workload. I think during COVID, people were just everybody in general was stressed and anxious, and so sometimes your interactions with clients weren't always the friendliest or best, and that takes a toll on team members. And so I think things have started to, come back to a little bit of a more normal plane in terms of how busy everybody is. And it was during COVID, it was impossible to keep support staff, for example. Like, everyone was just leaving the industry, and it was, um, uh, hospitals were competing with each other, raising salaries for techs and stuff. And there was just like this rotating system where a tech would leave one hospital, go to the next one, then they'd leave. And within a year, you'd see the same individual come back to the hospital. I think some of that has returned to normal, but one of the longest lasting issues I think that has been highlighted, and maybe this is a good thing about COVID, is it's made us as an industry and a field much more aware of the mental health aspects of ourselves as well as our team members, and that's finally, I think, becoming a bigger centerpiece for the industry, and taking care of people. Whereas before, it was kind of like, yeah, I know you're busy, but deal with it. Like, that's, just get it done and deal with it. That's what it is to be a vet. And now I think we understand the, driving someone so hard till they burn out isn't the right thing to do anymore, and we're starting to try to fix that.
Wow, that is hopefully a good byproduct. My understanding is that the percent growth of spending that Americans spend on veterinary services is outpacing dental and medical on a growth basis still, even after COVID. And just hearing you and all the kind of being overstretched, it sounds like, are the veterinary schools really meeting the demands for the services? I know there's a couple more vet schools opening up. I mean, how do you feel the vet industry is meeting this increased demand?
I think we've, as a field, been reactionary for a long time, which is hard. I mean, I remember when I first finished my residency, and I would go to some of the, like, our specialty conferences. A lot of the talk at the specialty conferences was, oh, these private practice residencies, we've got to get it, we can't let this happen. The market's going to be flooded with neurologists, and it's going to drive our compensation, and no one's going to have enough work to do. And I distinctly remember those conversations, and then within a couple of years, the pendulum swung completely to the other side, where we don't have nearly enough primary care doctors, ER doctors, specialists. So right now, there's a huge need in every aspect of veterinary medicine, whether that's food safety, large animal, agriculture, small animal. And I do know that the veterinary schools are trying their best. They're increasing class sizes. You're right, there are some new schools opening up. Um, but of course, unfortunately, one of one of the hard parts, I think, is state funding for some of these academic institutions has been, you know, an issue, a political issue in some states with budgetary problems, and so trying to figure out how do you um, get more veterinarians out there without, is made difficult if people know they're going to be coming out of veterinary school with $200,000 in school debt. So yes, they're trying to increase class sizes, start new schools, but one of our obstacles, I think, is how does a person finance that decision to go in the veterinary school, and I think if that's got to be an important part of the equation as well to encourage more people to go is, you know, making them feel comfortable that, okay, if I go and spend all this money, I'm going to be able to pay the loans back.
I want to focus on that for a second on just the macro environment of veterinary medicine. And this might be a surprise to listeners, but can you explain how the same company that makes M&Ms owns thousands of vet hospitals?
Mars.
Yes. Explain this.
Last I knew, I mean, I believe they own Blue Pearl, which is one of the largest multi-specialty and ER hospitals. They own VCA, which is also one of the largest multi-specialty ER hospitals. I believe they own Banfield, if I'm not mistaken, but which is one of the which is a very large general practice hospital. And then also, I believe they own one of the major food companies. I can't remember if it's Hills that they own. And then, yeah, so they control a huge share of the veterinary industry. And yeah, why how that even came about, how they differentiated from the candy industry into the how Mars got into the veterinary industry, I don't know, but I'm sure for the same reasons you just said, the growth in the veterinary industry is, or just the pet industry in general, has been um, so consistent for such a long time. I mean, it's been a good business decision for them. They have had some issues, I think, in some parts of the country where um, with monopoly issues, where they have had to, I think, like divest some of their hospitals, just so that they don't have such a high concentration of blue pearls and VCAs in one area. But yeah, it is true.
It's crazy, right? So if that's interesting. I mean, thinking about just the divestment, thinking about the increased demand and spending on pets and veterinary medicine, where do you see in the next 10 years the independent practices in the vet space going? Are they thriving? Are they shrinking? What's your prediction?
In my little bubble of the world here in Wisconsin, I do see people doing what I did, leaving the multi-specialty practices and opening up a practice that focuses just on surgery or dermatology or neurology. So I do see some doctors leaving the practices that are owned by corporations and starting their own practices. I still think that one of the biggest problems we have is, it used to be if you owned a practice, you would bring in associates and then you would just, you know, work out an agreement with your associates. They would buy the practice from you, whether they went and got a loan and bought it from you, or you came up with some sort of 5-year, 10-year plan to purchase the practice. But it, even though some people are branching off and buying or starting their own practices, it still seems that when doctors get to the retirement age and are looking to leave the profession and go on to the next chapter in their lives, that the corporations are still dominating that purchase process. That when somebody and I don't know exactly why that is. I don't know if it's because new grads are so saddled in debt that the thought of purchasing a practice is just something they can't handle, or if it's because the corporations just can outbid anybody else for these practices. But it does still seem that when a practice is sold, it's usually going to a corporation. That trend has continued. So I do think that we are gonna see some more independent practices open up. And one of the reasons for that is their job satisfaction, I think, within the corporations is not, for doctors especially, it seems to maybe not be as high as when they're working for a independent or their own practice. And so I think doctors will continue to pursue job satisfaction and quality of life, and therefore open practices. I It'd be nice to see those practices stay independent, in my opinion. And that's going to be the next issue, in my opinion, is how do we, because when somebody's worked for 30 years, they have a right to get compensation for all of their hard work. And I completely understand, if there's somebody has the cash to pay you what you need to retire happily and not worry about finances, why wouldn't you go with that option? But it would be nice to give some of the newer grads the ability to at least compete and potentially purchase these practices. And I think that part of that comes with figuring out the student loan debt. And that's I don't I don't pretend to have an answer to that. I know that's a very complicated issue, but if students didn't have to spend 10 years, 20 years paying off their loans, maybe they would have more financial resources to potentially buy into these practices. And then, one thing that veterinary school historically has not done a wonderful job of is teaching business. Maybe adding business classes as a core requirement for veterinary medicine would make new grads more comfortable with the idea of owning a business, and would help with that transition from one independent owner to other independent owners.
There are a lot of parallels in what you said across medical and dental as well. And actually echoing some of the stuff you said earlier, in our experience and working with folks across the country in all three fields, is when you get out of training, you kind of want to make sure you get your feet under you clinically. So getting those reps, getting the clinical experience. And then the second thing is, let me pay off some of these debts. Maybe not the whole thing, but let me start working on it and have a good line of sight on what's going to happen. And then once I kind of check those two boxes, I feel like I can, let me take a step back and maybe be in practice ownership. On the dental side is just new data that came out that from the ADA, from grads 0 to 5 years out, only 8% are becoming owners, right? But if you unzoomed and look at them, 6 to 10 or whatever, they all, not all, but mostly end up getting into practice ownership. It's just not something they do early on as much as they did 10, 15 years ago. Similarly, from the data I've seen on the vets as well, for all the reasons that you said, I think.
Yeah.
Let me ask a couple rapid fire questions as we round home, if that's okay. These are statements, and you will tell me if you think they're true or false. Okay, in your opinion, it says rapid fire, but generally there's a lot of conversation out. So let me just ask. Okay, first statement: true or false? Veterinary medicine is becoming more corporate than human medicine.
False.
Hmm.
My experience with my own physicians and doctors, I, I can't remember the last time I went to a doctor that wasn't part of some huge mega group, in Wisconsin, whether that's Ascension, Aurora Health. Um, so it seems that the human doctor world is most MDs. Well, maybe they have their own offices and their own LLC, but it seems that most doctors, in my experience, personal experience, are at least affiliated with a huge group.
Yeah, the data supports that as well. Okay, true or false? Veterinarians on average are nicer than physicians.
That is definitely true.
That is 100% true. I totally agree. Oh my gosh, it's just a funny thing, right? That's like if you go the trade shows are hilarious, right? So if you go to a vet show, everyone's so nice, welcoming, kind, and then even within the MD and DO space, if you go to an emergency medicine conference, like everyone's got on cargo shorts and trauma shears, and they're like super laid back. But the orthopedic surgery conference, I have a lot of ortho friends, but the people aren't. It's just isn't it funny? Is it nature or nurture? People that are nice just end up becoming vets. Is that it?
That makes me laugh. I think our orthopedic surgery group, they have one of their annual conferences, I believe in Vail, and they just go skiing. They probably have like an hour or two of talks in the morning, and then they just go skiing.
Yeah, I remember in med school, I thought I was going to do general surgery. I went to a conference in New Orleans, and I thought I was supposed to go to all the lectures, And the mentor I was working with, I was doing research stuff with, it was like 1 o'clock, and he texted me, he's like, "Where are you at?" And I'm like, "I'm at this talk." And he's like, "No, we're out." So I didn't know that was kind of what you're supposed to do at these.
You thought you were supposed to be learning.
I thought, yeah, I guess I didn't realize this. All right, next true or false statement. True or false? Movement disorders for cats and dogs are not all that different from movement disorders in humans.
I would say false only from the perspective that I think we understand much less about, we're just getting into the movement disorders, but we still just have all of these, it seems like idiopathic movement disorders. It's kind of a catchphrase, they're not responding to anticonvulsants, but it's some involuntary movement disorder. It's got to be a movement disorder, but I think we still have a lot of research that needs to be done into the actual etiology and development of therapies. In the end, they may have very similar etiologies, but we're in the very infancy of understanding them, I believe, in veterinary medicine. We're getting there, especially with the mapping of the canine and feline genome. We are making progress, but we've got a lot to learn.
All right, true or false? This is a tough one. Cats are better pets than dogs.
It's true.
True. Wow, we've dropped a bomb here on the podcast. I want to hear it straight from you. Why is this true?
I've always been a cat person. I grew up with cats. I have cats. So I'm biased, unfortunately.
I am biased as well, but I've heard a quote once, and it's kind of stuck with me, is the only reason cats don't eat you is because they're not big enough. And so it's made me question how much my cat actually does like me. I already told you she's not very nice anyway, because I guess I drugged her with gabapentin on the airplane. But that's great. That's interesting. All right, so we are, in our last question, we ask every guest this. We are in an era of human history where we've never had more information every day. So the question is, like, how much do we take that information and actually change from it? Or is it just affirm all the things we already believe? So the question is, what's one thing you've changed your mind about recently? It doesn't have to be about your profession. It can be about anything.
I underestimated how difficult it was going to be balancing family with my professional life. And I wish that I had I just wish I've been better with that. Like if I could do something all over again, I wish I started at a younger age, prioritizing family a lot more. You're just, when you're right out of school and you're, a professional, it's like you just feel so much pressure to achieve and please your bosses and sometimes, unfortunately, I think our loved ones kind of get shoved to the side, and that's not right. They should be our priorities, and so that's one thing. If I could go back, spend more time with my family, and of course, the good thing is you always have the future, and you can correct those errors and make up for it. But um, we say a lot about work-life balance, but at least in the veterinary industry, we're not there yet.
Yeah, I think that's across all the in medical and dental space too. I think part of it, I don't know if you agree with this, is it just our identity is so wrapped up in the vocation, maybe more than the average vocation. When people see you at holidays or at gatherings, like they ask you questions about your job, ask about advice. I already asked you about cats, and I'm on this podcast. And so it's like wrapped up in, I think, a little bit, right? And so it's a lot of pressure to continue to be that, I think. Also, you spent so much time and money on it. There's a lot of pressure there too. I don't know if that resonates with you at all.
Oh yeah, absolutely. I mean, I struggle all the time with a case. Somebody calls and they have whether it's another vet or a client, and they want to be seen, and it's like 5 o'clock at night, and part of you is like, I need to see this dog, to help them, help the family, but you also haven't, you need to be home and see your family too, and it's a constant struggle all the time.
Do you guys take call? Is that how it works? I mean, I don't. This is new to me for you guys.
Yeah, we're on. I mean, because I'm the only neurologist at my practice, hopefully that'll change in the near future, but I'm kind of on call 24/7. I have some personal boundaries Monday through Friday. When I leave the building, I try not to come back in. If it's if it's like 9 o'clock on a Sunday, I'm probably going to try to set it up where I see that case first thing on Monday morning. But if they call at 10 a.m. on Saturday and they've got a paralyzed dog, I'm going to have to come in and see them. Now, other neurologists would probably say that's just not enough. Somebody needs to be going in at 10 p.m. every night if there's a down dog, and so for me, because I'm the only doctor, I am um, formulating some of my medical decisions based on my work-life balance, whether that's right or wrong. As I add associates to the practice, we'll probably increase our on-call availability.
Yeah. I have a lot of questions there, but I know I've taken a lot of your time. I appreciate you spending so much time with us, Dr. Moeser. Congrats on the success. Appreciate you being here and sharing your wisdom. Is there any place that people can find you more or online?
Yeah, you can go to wisconsinanimalneuro.com is our website. Check out our blogs and educational videos and whether people have just a general veterinary neurology question or an animal they need us to see, give us a call, send us an email. We'd love to help.
Awesome. Thank you, Dr. Moeser. Appreciate you being here.
Oh, thank you for the opportunity. Appreciate it.
Thanks for joining us this episode, and you can catch the podcast for Doctors by Doctors on Apple, Spotify, YouTube, and all the other major podcasting platforms. If you enjoyed this episode or learned anything here today, please take a moment to give us a rating and subscribe so that you don't miss a single episode release. To submit topic suggestions or guest suggestions or questions, you can reach us at podcast@panaceafinancial.com. As always, thanks for listening, and the next time you see a doctor, maybe you should prescribe them this podcast. See you next time.